Let's take you to KwaZulu-Natal now, where 61 healthcare workers across across two provinces, I should be specific, in that province have been infected with COVID-19 since the start of December. Durban's Eddington Hospital is one of the worst affected, along with Chatsworth R.K. Khan Hospital. For more on this story, we're joined by our reporter Karinda Jagmohan, who is following this story, and she talks to us now from Chatsworth. Karinda, good morning to you once again. So you are at a health facility there. What's the situation in that area? Has it also been declared a hotspot?
Yes, good morning to you. Well, currently, as we know it, hospitals in KwaZulu-Natal have been impacted by the spread of COVID-19, the second wave, as we're referring to it. I'm currently at a healthcare facility here in the Chatsworth community, and in this facility is Dr. John Sebastian, who'll be speaking to us. He's part of the COVAC committee, that is a community-based organization that was formulated at the start of this pandemic to assist in ensuring that residents are adhering to precautionary measures, but also assisting in allocating relief funds, relief aid across this community. But Dr. Sebastian, who joins us now, you have had your surgery here in Chatsworth for years now, but just in this month alone, you've already been impacted by the closure of local healthcare facilities. Tell me about the experience you had just last night, you said, with one particular patient.
Yes, thank you, Karina. Last night, actually this morning, 2 o'clock this morning, a patient of mine who's only about 35 years of age phoned me to tell me that she has difficulty in breathing. Now, I have provided her with an oxygen meter, pulse oximeter, which would measure her oxygen saturation. And I told her that if the oxygen saturation comes below 94, she needs to phone, because it should be between 94 to 100%. She phoned me telling me that her oxygen saturation was 92%. And I got worried because she was also having difficulty in breathing. So I said to her, we have to admit her to a hospital. But knowing that in Chatsworth, the private and state hospitals both are now on divert because they are both full to capacity, I then had to try to send her to another hospital or divert her to another hospital. And for you to know that she was diverted right to a hospital in the Midlands early part of this morning, about 4 o'clock this morning.
Well, of course, Doctor, just for our viewers, the Midlands is about an hour travel outside of Chatsworth. How is this second wave impacting a surgery such as yours? And just tell us more about the picture of healthcare here in Chatsworth, which you said is becoming a hotspot again in the second wave.
Yes, it's becoming a hotspot again in the second wave, mainly because I think people in Chatsworth now believe that it's okay to be with people who are COVID positive, and people don't come to the surgery on time. In other words, if they are positive by contact with another person, including a contact with another person in their own home, they wait until they think they need to have symptoms before being tested. But remember that they can be positive, asymptomatically positive, and then still spreading the disease to other people in the community. And this also has an impact with us as medical personnel, because they come in and say, I'm fine, I'm quite well with no problem at all, and failing to follow the protocols set in place, and therefore putting medical personnel and the community at large at risk again.
Of course, there's a danger there with asymptomatic patients. Yes. I'd like to know, Doctor, what's your view as a healthcare professional operating in a hotspot in the province? What is your expectations, especially tonight when the President is about to address the nation? We expect to have more precautionary measures in place, possibly another level of lockdown. What would you like the President to say?
I would like the President to actually, yes, have another lockdown. Actually, to most importantly, to stop people meeting, aggregating in numbers, especially during this time of celebration. During Christmas, when people will meet and celebrate, I would like this numbers to be curtailed and stopped. I'd also like the numbers to the beaches, or some way to stop the people at beaches being very close together and not more than 2 meters apart.
Absolutely. Thank you very much, Dr. John Sebastian. He's been speaking to us about the impact of the second wave of COVID-19 on surgeries, healthcare facilities in areas that are hotspots. Currently, Chatsworth, one of them. The Department of Health saying yesterday that 61 healthcare professionals across 2 hospitals, that's Durban's Addington Hospital and the RK Khan Hospital here in the heart of Chatsworth, have been have tested positive for COVID-19. And so what we're seeing now is that doctors on the ground at this stage want more measures being put into place, especially as we head into the festive season, to ensure that the healthcare facilities are not further impacted and are bearing the brunt of COVID-19 patients, whereby other trauma issues and other healthcare issues are being sidelined or have to be diverted because of the COVID-19 wave. So we'll be exploring that story throughout the day, of course, up until we expect the President to announce further measures tonight.
Karinda Jagmohan, thank you very much for that update live for us in Chatsworth there. And that issue of beaches coming up during that interview. Very, very interesting indeed to watch what the President is going to say tonight about the provinces who've requested that beaches perhaps be closed.